have a story of grit, determination, and an unwavering desire to be the change that we wish to see. This is the story of Enactus Ramjas.
As a land of diverse cultures, as a land of technological marvels, and as a land where our stories exemplify our diversity, India has risen as a beacon of optimism, pride, and resilience. However, all our stories have challenges. Challenges of poverty, inaccessible healthcare, and food insecurity, which are crippling our growth and ambitions.
You see, there is a small village of Hapur in the outskirts of Uttar Pradesh, one of the many parts of our country that remains bereft of fundamental facilities, and whose residents suffer from unavailability of affordable and accessible healthcare.
Upon interaction with these individuals, we decided to conduct a comprehensive health survey. What we saw was the harsh reality of the 3,500 residents of Hapur, neglected and overlooked by the government. More than 1/3 of its population was physically and cognitively stunted.
With majority of the people earning meager incomes of less than rupees 200 per day, and the closest healthcare center being more than 10 kilometers away, affordable and accessible healthcare was a pipe dream for them.
We knew something had to be done. We knew this was going to be a mammoth task, but Enactus Ramjas believed. We believed in a brighter future for the families of Hapur. We believed that challenges do not define who we are, and thus was established the first Arogya Center.
Under Project Arogya, we set up healthcare centers that provide 4 comprehensive services. Our centers work holistically towards making healthcare affordable and accessible to the people residing in rural and peri-urban areas.
The first component of Arogya is establishing a retail of generic medicines. Now, what are generic medicines? These are medicines which have the same chemical composition as that of their branded counterparts, but can cost as low as 20% because of an elimination of brand.
However, a well-established nexus between pharmacies and medical practitioners ensures that profitability supersedes health concerns, and thus the law of prescribing only generic medicines to patients is not followed.
Affordability was not the only major issue. Lack of medical diagnosis and preventive screening accounts for roughly 5.8 million deaths. All these factors contribute massively towards deplorable healthcare conditions. Hapur was no different.
In order to tackle this issue, we established the second component of Project Arogya. We collaborated with leading hospitals and established a chain of 7 charitable doctors who started rendering consultation services at a very nominal rate to the village residents. As our third component, we partnered with Mahavir International and integrated pathology services into our model.
As a fourth component, we started conducting various community development sessions on issues such as disease prevention, sanitation, and symptom management. This ensured that people were now aware about various diseases, their symptoms, and also the effective steps that can be taken for their prevention.
In a matter of only 3 months, we saw a staggering 70% decline in medical expenditure, and at the same time, an increment of 30% in the number of people availing medicines.
Gradually, we managed to bring about a sea of change. However, we didn't come this far to come this far.
By carrying out critical need assessment surveys in numerous locations across Delhi, Haryana, and Uttar Pradesh, we established the Arogya Health Index. Comprising of more than 12,000 respondents, this enabled us to get a more comprehensive understanding of the most pressing health concerns each demographic faced.
We included a multitude of parameters ranging from mortality rate, child immunization, to various acute and chronic diseases that the people suffered from. What we saw were similar stories of struggle and suffering. Realizing the immense potential Project Arogya had and banking on the success of our first center, we set forward to replicate our model.
Project Arogya has now expanded to 17 locations and has impacted more than 1.5 lakh individuals.
Our interventions have managed to save more than rupees 8 million in medical expenditure.
With 61 doctors on board, more than 90%
immunization services. Child immunization rate has increased from an alarming 35% to a remarkable 87%.
However, such advancements could not have been possible without our beneficiaries who have acted as pioneers of change in the project. Each healthcare center empowers 4 entrepreneurs who take care of all forms of operations. A registered pharmacist, an assistant pharmacist, a lab technician and a caretaker.
Firstly, the pharmacist, who's provided a microloan of up to rupees 80,000 to set up operations at a very nominal interest rate of 0.5% per month. This is done with support from our partners at IIFL.
The assistant pharmacist and lab technician undergo specially designed certificate courses at NSDC. This equips them with all the necessary skills to handle their respective roles. Additionally, a caretaker is appointed who handles all communications and is responsible for supervising the healthcare center.
Once unemployed and disengaged, our 58 beneficiaries are now earning rupees 12,000 per month on an average. Out of the total proceeds generated from sales, 50% is the profit earned on cost. Out of this 50%, 85% is distributed amongst the entrepreneurs based on their job profile, and 15% is kept by Enactus Ramjas for reinvestment. This model has resulted in a sustainable business for all our beneficiaries.
The story of Project Arogya does not end here. Upon getting recognition from major publications, we were approached by the Rajasthan government to set up our healthcare centers in the village clusters of Naggi and Mukund, located along the Indo-Pak border. However, the inaccessibility of these prospective locations posed as a major roadblock. To solve this problem, we partnered with Tantia Hospital and the Border Security Force to set up Tele-Swasthya.
A subset of Project Arogya, Tele-Swasthya, provides services of teleconsultation and telepathology through digital communication. This falls in line with the government's vision of Digital India and has enabled us to bridge the gap between patients and medical practitioners.
A nominal fee of rupees 50 is charged for every consultation through Teleswasthya. Out of this, rupees 25 is earned by the doctor, rupees 20 by the technician who is trained to facilitate the consultation, and rupees 5 is kept by Enactus Ramjas to recoup its investment.
In telepathology, we conduct diagnostic tests on our very own portable platform. The system is connected with an interface that sends all the diagnostics to our partner hospitals. The results are then delivered to the patients via SMS.
Through real-time analysis of primary diseases, we have ensured effective treatment of more than 3,000 diagnoses.
By enabling remote patient monitoring, more than 1.5 lakh has been saved on travel expenditure.
And finally, through critical intervention during emergencies, Teleswasthya has emerged as a ray of hope amidst the silent suffering of those in distress.
Meet Samir, our pharmacist who handles Teleswasthya at our center in Naggi village. In the wee hours of May 21st, 2018, Samir successfully facilitated a long-distance emergency consultation between Kamal, who had suffered a heart attack, and a cardiac specialist stationed at the nearest hospital 51 kilometers away. Within a few hours, Kamal was transferred to intensive care. However, our intervention managed to save a life.
Meet Sarika, a resident of Mukund. She earlier used to spend 4 days in getting her monthly pregnancy checkup done. With Teleswasthya, that time has reduced to a mere 40 minutes.
Such examples are not few and far between. Every day, people come through the doors of our clinics and have stories to tell. Stories of rejuvenated lives. Stories such as this.
बहुत कम पैसों में दवाई मिलती थी।
टॉट रेट है वो नहीं मिलता है, मतलब उससे कम ही मिलता है।
दवाई सस्ती मिलती है और हमें कहीं दूर भी नहीं जाना पड़ता।
आरोग्य के कारण हमारी दवाई सस्ती है।
वेरी गुड आरोग्य।
आरोग्य आरोग्य आरोग्य
Project. Initiated in 2016, Project Bawarchi works towards solving the problem of food insecurity by providing rehabilitation and financial inclusivity to the victims of substance abuse.
As per the UN report of 2015, India tops the hunger list. 1 in 4 children are stunted, famished, and malnourished, and over 20 crore Indians go to sleep with an empty stomach.
We carried out a critical need assessment and a thorough research of these individuals and realized that majority of the hunger-stricken resort to recreational drugs in order to temporarily numb their feeling of hunger.
Such exposure to substance abuse makes these individuals commit petty crimes and thefts to carry on with their addiction. And post-rehabilitation, they find job opportunities extremely difficult to come by.
During a community outreach program, we interacted with 4 such individuals at a rehabilitation center in New Delhi and identified their keen interest in the culinary business. By harnessing their skills and providing them expert training in collaboration with Hayat, we established the first venture under our project, the Bawarchi's Canteen.
Providing quality food at unparalleled prices. In a few months, our canteen was serving more than 500 meals per day, and these 4 individuals had become independent entrepreneurs.
With examples set by our first batch of beneficiaries, the number of interested members for being a part of our project increased. And by June 2017, we had created 22 entrepreneurs serving in 2 canteens and 4 food carts.
The year 2017-18 has been all about growth, and we are now tackling food insecurity like never before. Through our 3 avenues, Project Bawarchi has exemplified sustainability and scalability. Let us take a closer look.
In each of our canteens, we employ 5 beneficiaries who take care of all forms of operations, from handling orders, finances, purchases to general logistics. This year, in collaboration with SPYM, we have expanded our canteen model to 2 more prime locations in Delhi.
We established various layers of quality control check, and all our canteens are now FSSAI approved.
By digitalizing operations and teaching our beneficiaries the basics of computing, we now receive orders electronically through various food ordering apps and the independently run Bawarchi app. Through our online channels, we are now delivering more than 150 orders per day.
Moreover, through our tiffin services, we are now providing calorie-defined meals to a subscriber base of more than 200 individuals.
Bawarchi on Wheels now employs 24 beneficiaries across a fleet of 12 food carts. Stationed at various locations across Delhi, our food carts have become an instant hit amongst workers and masons.
We have also expanded our services to include private caterings and public events, serving in over 59 events throughout the year.
India today faces a massive uphill battle to tackle nutrient deficiencies in both the rural as well as urban sector. Guided by an ambition to comprehensively tackle the growing issue of chronic hunger amongst the homeless and food insecure individuals, we partnered with the Delhi government and launched Food for 7.
Under the Food for 7 model, we provide quality meals at subsidized costs in shelter homes across Delhi on all 7 days of the week. This year, we established 3 new kitchens specifically to cater to this target population. In collaboration with Nutrition International, meal plans are designed for various age groups, which fulfill their daily caloric requirement in the most cost-friendly way.
Serving food to 30 shelter homes across Delhi, an increase of 18 from last year, we are now providing meals at rupees 12 per meal, bringing it down from rupees 15. This has been achieved through economies of scale and by using various methods of efficient cooking.
In the month of January, we met Rahi and Pranav at Salam Balak Trust, one of the shelter homes that we provide food to. With no money in their pockets, they survived on scrapes and whatever little food they could find. Suffering from acute nutritional deficiencies, their lives were at a standstill. Let us hear from them 6 months after our intervention.
खाना नहीं मिलता था और हम भूखे रहते थे, हमें अच्छा खाना नहीं मिलता था। जैसे बावर्ची हमें मिला है, वैसे हमें भूखे जैसे हमारा अच्छा खाना मिलता है, हमारे पेट भर जाता है।
Such has been the story of Project Bawarchi. From being victims of substance abuse to bringing a revolution at the very grassroots level through serving food, our 50 beneficiaries earn an average of rupees 14,000 per month. Out of the total revenue generated, 50% is the cost of production and 50% is the total profit. out of the total profit, 80% is given to the entrepreneurs based on the job profile, and 20% is retained by Enactus Ramjas for reinvestment. Moreover, under Food for 7, the remainder of 20% after covering our costs is also given to the entrepreneurs.
Seeing opportunity, taking action, enabling progress.
Our 3 avenues have generated rupees 9 million in revenue.
Served over 450,000 meals.
Fed over 50,000 mouths.
Empowered 50 entrepreneurs.
Established 7 institutions.
And brought one small, yet significant revolution towards eradicating food insecurity.
2 years ago, none of this existed. Project Arogya and Project Poverty, 2 out of the 8 sustainable projects that have helped Enactus Ramjas change our society and empower underprivileged individuals.
All ideas start from simple concepts, and for next year, we are on track to establish 40 healthcare centers and bring a positive change to more than 1 million lives.
Expanded into all 75 shelter homes across Delhi and serve more than 10,000 meals on a daily basis.
Generate employment opportunities for more than 250 individuals.
And be the flag bearers to a better tomorrow.
With a team of 80 active volunteers, contributing more than 45,000 hours, the year 2017-18 has been all about transforming ideas into realities. We believed and we did it. We are Enactus Ramjas, and this has been our story.
Judges, please join me in thanking the institution Ramjas College for their presentation and their hard work. Now we will start with question and answer round. Only judges may ask questions.
Good morning, I'm Pratibha, and I just wanted to find out in your project Bawarchi, you said that you give entrepreneurial opportunities to the substance abuse victims. What is your kind of counseling that you undertake? Because my experience with them has been that you really need to keep them continuously engaged in counseling.
So thank you so much for the question, ma'am. I'll be answering that. So initially, when we ventured into the project, for each beneficiary to be inculcated into our food catering avenues, they are given rehabilitation sessions for a period of 3 months by SPYM. And after the rehabilitation is complete, Enactus Ramjas and Hayat, we provide expert culinary training as well as various soft skill training to these beneficiaries in order for them to not only learn how to make food, but also their interaction with other people and how their hygiene and also how they should interact with prospective customers as well.
Thank you, but I'm still questioning the counseling part. Anyone who's been subjected to substance abuse needs to be in a continuous, so just my bit of advice that keep it going throughout so that they don't slip back into it once they have money in their hands.
Morning. I'm Prateek. I actually had a question which is probably pertinent to both Arogya and Bawarchi. So I understand there are about 4 individuals operating the Arogya clinics, and then there are people at the Bawarchi clinics, at the Bawarchi canteens. So I just want to understand ultimately who are they accountable to, and how dependent are they on individuals on your team, especially if something goes wrong in either case?
Okay, sir, in answer to your question, all the beneficiaries they have a certain share in the profit that's being generated. So their accountability in the first place is they are accountable to themselves and also to the fact that we enter into contracts with respect to Arogya. We enter into contracts with all 4 of our beneficiaries during the time of establishment of a healthcare center, and so they have to abide by the contracts or the stipulations that are agreed upon in the contract. As far as Bawarchi is concerned, sir, we have, as it is mentioned in the annual report, we have a specific time of sustainability period of 18 months for the canteen and 6 months for the food carts. So during that period of time, members from our team visit these establishments, visit these avenues regularly, so as to ensure that all the beneficiaries are conducting their operations in a smooth and transparent manner. After which, when they know how to deal with customers, when they know how to handle operations on their own, we slowly move out of the process. So giving you an example, last year when we incepted Project Bawarchi, our involvement in the project was much more. However, coming forward to this year, we have slowly managed to draw ourselves from the process and have worked towards sustainability of the project.
So just one quick follow-up. Is it right in saying then, if unfortunately if there's a mishap at a clinic, it would be those 4 individuals who are responsible and not your team or Enactus Ramjas as well? team.
Sir, if I'm interpreting the question correctly, do you wish to know whether if someone falls ill by consumption of the medicines that we sell?
Yeah, so firstly, with respect to that, we believe that we undertake various measures in order to ensure that something like that does not happen. When we talk about these different aspects, different avenues with respect to how necessarily the pharmacist is going to be, the medicines that we are procuring are from a licensed supplier, and everything is done only on a prescription basis. Only when we have a prescription, only then a medicine is supplied. So we act only as the suppliers and the connecting link between the doctor and the patient, and hence ensuring that ensuring that the kind of responsibility is something that is onto the doctor based on the prescription that he or she has given.
So I'm Rahil, by the way. Good presentation. I'm curious to understand, so your partner hospitals are private hospitals, and these people would have otherwise been going to public hospitals. So how are you then quoting that you're reducing their expenditure in those cases?
So, sir, thank you so much for the question, sir. Sir, in all of our target communities where we have set up healthcare centers, the people had to walk enormous distances in order to reach the nearest private and either private or public healthcare center. Giving the example of Hapur, the nearest healthcare center was 7 kilometers, whereas the nearest hospital was 10 kilometers away, sir. And the kind of agreement that we have with the hospitals is completely on a charitable basis. So all the doctors that come to our centers for consultation, they are social activists on their own right, and hence the reason for joining us in the first place, sir. And
like adding on to that, the very aspect, the incentive that we talk about to the hospital being that when necessarily, see, the very crux of the teleswasthya model is that it acts on the discretion of the doctor. If and when the doctor is not convinced or has some doubts with respect to going by a virtual medium, we have transport facilities arranged by Tantia Hospital, and this is something that leads to, and this is like an added incentive for our collaboration, that they get more and more walk-ins, and that acts as a successful and a symbiotic relationship between Teleswasthya and Tantia Hospital.
Thank you, team. I want to cut it down. Your time has expired.
thank you so much.
Thank you.